free wellness program that is coming.
We lost you, Allison. Allison? I think she actually went off of the screen, so I think she's having a problem with her computer. So while she figures it out and gets back on, I think we're going to go forward. Jesse, if you wouldn't mind introducing yourself and then starting with the program, and we'll get back to Allison's announcement at the end of the presentation.
That works. Can everyone hear me?
Yep, we're good.
Okay. All right. I'm Jesse, guys. I am a physical therapist with LMH. I'm going to share my screen here real quick. Okay. So like we've talked about, we're going to talk about how to keep moving with joint pain because it's something a lot of us suffer with. So a little bit about me. Let me minimize my. So I'm originally from close to here. I'm from DeSoto, Kansas. My parents still live there. I went to Kansas State. No one boo me for my bachelor's in athletic training, and then went to KU Med for my doctorate in physical therapy and graduated in 2018. I've been with LMH since I graduated, so we're going on 6 years here, which is crazy. And I'm currently over at Ortho Kansas LMH West campus, and I work only an outpatient and specialize in orthopedic and sports medicine. I'm also part of our aquatic therapy team out there and also still do a little athletic training stuff. So if you see me poking around the schools, if you have any grandkids or kids still in school, that's why. I live here in Lawrence with my husband and my dog, Misha, who's laying next to me right now. She's the German Shepherd. And then I'm still a K-Stater, despite my husband being a KU grad. And we just travel in our free time right now, enjoying not having kids yet. We went to New Zealand last year, which I still want to go back already. But all right, let's get into it. So, this could be you. We could be jiving with Richard Simmons, but maybe it feels a little bit more like this when you try to exercise. Let's see if we can change some of that or at least make it better. We're going to start a little bit of background anatomy just so we know what we're talking about as far as our joints, what joints we might be covering today, and what we're not going to cover as much because they don't tend to cause us as many problems. The first type of joint we have is a fibrous joint. These are more the joints of our skull. They don't really move. They're held together by a really tough fibrous connective tissue, and there's no space present between these. The second type of joint, we're not going to really talk about these because most of us don't have problems with the joints in our skull. Our second type of joint is a syndesmosis joint. Now, this could be something we have problems with. We heard a lot about these this time last year, and I will see if anyone remembers why. We had Patrick Mahomes dealing with a high ankle sprain in the playoffs last year. This is a syndesmotic injury. These are bones that are connected by a big long sheath of connective tissue. They allow for a lot of motion, a lot of twisting between the bones, like the joint between the tibia and fibula, so that top part of our ankle. And then we have cartilaginous joints. We don't deal with a ton of these. The big one we talk about are growth plates, are actually joints. But we do have pubic symphysis, which is this kind of area in between our pelvis. And it's just a big piece of cartilage that connects two joints. There's not a ton of movement there. The primary ones we're going to be talking about today are our synovial joints. So these are joints that connect our two bones. There's space in between these bones, or there should be space in between these bones. And then they're surrounded what's called a joint capsule. It's just a big fibrous connective tissue. And it also contains synovial fluid, which is just a liquid inside the joint cavity. So let's dive into the synovial joint anatomy just a little bit more so we kind of know some of the stuff we talk about. So our first anatomy we're going to talk about is the cartilage. So with this, it's a specific type of cartilage that covers the surface of the bone. You see that purple line there on that lower picture. We're specifically talking about hyaline cartilage in this, and all it does is it's there to reduce friction with movement. In a healthy joint, we have this, it's a nice smooth membrane and it helps just kind of glide. It's really, really glossy. It's kind of cool. The second part is our synovial membrane. So this is the inner part of that joint capsule, which is that blue line there. All it does is it seals the joint capsule and it secretes synovial fluid, which would be in that pocket, kind of that red squiggly line there, which helps lubricate the joint, again, reducing friction. And then the outer part of that joint capsule is just that more fibrous part of that connective tissue. It helps provide passive stability. The other parts that aren't on these pictures as well, we have ligaments that are on the outer band of the joint capsules and attach bone to bone. They provide support and they limit movement. We can have problems with these. We get tears in these a lot, especially younger in sports, but we can have degenerative problems with these as well. Tendons, we can have a lot of problems with that feel like joint pain, and we'll talk about these too. The connective tissues, this attaches muscle to bone, so it provides movement. Our skeleton really is just a bunch of levers for our muscles to move. And then we also have bursas. I'm sure a good portion of you may have been diagnosed with bursitis at some point. It's a pretty common diagnosis. And these are just little fluid-filled sacs between the bones, ligaments, other structures. They, again, just help reduce friction and to help provide a little bit of padding in those bonier areas. So then let's get into different types of pain. So two big ones we're going to talk about. We can get a lot more specific. We're going to keep this pretty general today. So we have nerve pain. This is often burning, tingling, pins and needles, numbness. It can be caused by orthopedic problems, such as problems in our spine is a very common area that we get nerve pain coming from because of more of a joint problem. Or they can be idiopathic. If anyone has neuropathy that maybe don't know where it came from, it can also be caused by comorbidities such as diabetes. Chemotherapy treatments can also cause nerve pain, and this mostly affects the hands and feet. And then muscle and joint pain is what we're primarily going to be talking about today. This is typically more described as tender, throbbing, stiff, maybe dull, achy. It can be sharp, especially more acute problems. And it's typically caused by something, either an acute injury, so a fall or twist, can be caused by overuse. Maybe got too into pickleball this summer and maybe have a tendonitis problem in your shoulder, or it can also be caused by an underlying condition, which is what we're going to focus on today, such as arthritis. So what can cause joint pain? So this is not an exhaustive list, because an exhaustive list would last 17 slides, I think, on its own. These are our big ones. Osteoarthritis is one we all hear about a lot. We can have autoimmune conditions cause joint pain, rheumatoid arthritis, psoriatic arthritis, lupus. We can have fibromyalgia cause joint pain. And we can also have soft tissue injuries such as sprains or strains, which are ligaments or tendons, muscle, but they can cause pain in the joint as well. So we hear osteoarthritis just talked about as arthritis. And as you can see here, there are different types. So what are the differences between osteoarthritis and rheumatoid arthritis? So osteoarthritis typically is what we get diagnosed with more as we age. It starts in a single joint as that hyaline cartilage, that smooth cartilage on the surface of the joint, wears down. That's when you might be told you're bone on bone. And it's considered part of the normal aging process. Most of us get some level of arthritis, but it can be affected a lot by different things. Genetics is a big part of it, activity, lifestyle, diet, all of that can affect how we develop arthritis. Rheumatoid arthritis, on the other hand, like we said, is an autoimmune disease. So that just means that the immune system's malfunctioning. It starts attacking the synovial membrane versus that hyaline cartilage, which in cases it protects the joint. So as that synovial membrane gets damaged, we don't secrete that synovial fluid, and then that hyaline cartilage starts to rub on each other. This will typically start targeting several joints at once. It's a little more symmetrical versus osteoarthritis can affect more just one side. And then we also get more of those immune responses with rheumatoid arthritis. You might have fever, fatigue, anemia, loss of appetite. It certainly can be diagnosed at older age, but typically people start getting diagnosed with this when they're a little bit younger, when they start presenting, usually in the 30s, 40s. So we'll We're going to talk more osteoarthritis just because it's more of what the general population, but a lot of these things can also be applied with rheumatoid arthritis. So then we'll talk exercise recommendations. We went 65 and older, which really isn't that different from 65 and under, except for the addition of balance activities. The CDC recommends 150 minutes a week of moderate activity, which would be approximately 30 minutes, 5 days a week, or 75 minutes of vigorous activity. And we'll talk a little bit later about the difference, how we define moderate versus vigorous activity. Most of the time, we're going to be dealing more in that moderate intensity range. And then 2 times a week of strength training. And this is all muscles in the body. This isn't just 2 times a week of arms or just 2 times a week of legs. We need to train everything equally. Like I said, balance activities, but a lot of this can be incorporated into both our cardio or our strength training. It doesn't have to be separate. It can be anywhere from yoga to Tai Chi, or even just standing on one foot is a balance activity. Walking is great, working on the balance. So these are all, they can be incorporated together. It doesn't have to be separated out as much as we think. And then the benefits of exercise. We all hear we need to exercise, we need to move more, we're sitting too much, but why do we need that? So we're going to break this into those 2, aerobic, and then we're going to break it into resistance training, which is considered an anaerobic activity. So aerobic activities are usually longer duration. They're really targeted at large muscle groups, increasing heart rate and sustaining that increased heart rate. The benefits of these, there's a ton of benefits of aerobic activity. It's a decrease in cardiovascular disease. It helps manage blood pressure. It can help manage anxiety, regulate blood sugar if maybe we're dealing with diabetes. It can help reduce chronic pain. There's been several studies, if you're dealing with fibromyalgia, to show that 30 minutes of just moderate aerobic activity can help reduce pain significantly. It also can improve our sleep and immune health, where it's all really important, especially this time of year when the flu's going around. And it helps reduce risk of falls. There's a ton of things that can be aerobic activity: walking, running, cycling, swimming, rowing, dancing. There are classes that can be aerobic as well. There's yoga that can be a little bit more aerobic. And then resistance training. So resistance training is, like I said, an anaerobic exercise, which just has to do with the cellular processes. It doesn't use as much oxygen as aerobic activity. And then it's working a muscle against a force or a weight. It can be gravity, it can be body weight, machines, free weights. It doesn't have to be a specific type. We all think powerlifting, these big bulky guys in the gym doing resistance training, but it's a lot more than that. And this is important because it helps build strength and muscle mass. There's been studies to show that sedentary individuals start losing 3 to 8% of muscle mass with each decade of life. Very important because muscle mass helps prevent falls. It's good for longevity. It reduces risk of osteoporosis, which especially in women is a big risk after menopause. It can maintain flexibility. It actually increases our resting metabolic rate, which we all talk about, losing weight. We're not going to really talk about that, but the more muscle mass you have, the more calories you burn at rest, which is really how we help maintain a healthy weight. And it also can help improve posture, which we all need to work on as I sit up a little straighter, and again, improve sleep quality. So aerobic versus resistance, which is better? I can send copies of the prisoner slides too. I'm going to probably answer these at the end because I'm a little ADD and we'll get distracted. But so one's not better than the other, but both are an important part of a healthy exercise routine. However you can incorporate them in, whether it's a little bit of this together, if you do them on separate days, that's not the important part, but you need both, really. When dealing with joint pain, you can definitely perform both. I know it's counterintuitive when we're hurting to load a joint, but if you've ever been to PT, you probably have experienced that, especially if you've been out west with us. We have to load stuff. We have to get you stronger in order to help that pain and to help just in order to maintain a healthy lifestyle. So we're going to talk about both aerobic and resistance training. And pretty much every PT will tell you the best type of exercise is the one you'll actually do. So we might push you to do resistance training, but if you're gonna, as we'd rather you move than do nothing. So first we're gonna talk about acute joint pain. I wanted to go over this briefly first because I think it's not as much what we're dealing with. We're probably dealing more with chronic joint pain if we're talking arthritis, but this is something important too, because we all can have it, especially once the weather starts getting nicer, we start going outside more, doing a little more. Sometimes we'll get these sudden onsets of pain. So the first thing to ask yourself, if you wake up, so you wake up and your knee hurts. Was there an accident or an incident that you noticed an onset of this injury? If yes, if there's a fall or if it's severe pain, don't exercise that day. Go talk to your doctor, see orthopedic, or if you have a physical therapist you trust and like already, maybe reach out to them and they can give you a little more guidance because they know you. If it's mild, moderate pain, you don't have to go to the doctor right away. Maybe give yourself a week of rest with gentle movement, short walks, biking, depending on what kind of exercise you like. But just short periods of time. I'm talking 10 to 15 minutes, depending on your activity level, just to give time for tissues to heal. And then when you're returning, if you are returning to exercise in this case, you want to start with a reduced volume or intensity. And if pain doesn't increase as you start to exercise again, then you can increase safely. A pretty conservative volume would be about increase 10% a week. So if you're walking a mile, adding a 1/10 of a mile a week is a pretty slow and safe way to return. That's probably a little conservative, but I'd rather be conservative here than tell you to just go for it. If there wasn't an injury or an incident that you remember, you just woke up with pain, if it's severe pain, still see a healthcare provider, call your primary care or orthopedic. If it's really severe, go to the ER and get checked out. You always want to make sure there's no fracture or anything going on before you start exercising. And kind of same case here. If it's mild to moderate pain, reduce your volume and intensity of what you're doing. So if you're walking a mile, maybe try half a mile. And then just help manage those symptoms for up to a couple weeks. You can ice, you can heat is okay as long as it's not the day after and you're really swollen. If you're swollen, use ice. Some compression can be good for a week or two. And see the soreness rules. We'll talk about those towards the end because those are more of what people are looking for when they're having joint pain. So I wanted to save those. And as the intensity of the pain decreases, then you can start increasing your volume again. Again, about 10% a week is pretty conservative measure to start building back to where you were. So that's acute pain. What about chronic pain? This is more of what we were dealing with. First, if you're having chronic joint pain anywhere, have you had it checked out? Have you seen your primary care? Have you seen a physical therapist? Have you seen someone to assess this injury? If no, go get it checked out. A lot of joint pain, we attribute to, oh, we're getting older. This is just something I have to live with. And that's not necessarily true. Chronic injuries can cause these problems that just kind of spiral. They can cause muscle inhibition, imbalance, loss of range of motion that may be contributing and continuing these symptoms that we can help address. For example, if say you have chronic knee pain, maybe you do have some mild arthritis in there. But what can also happen is we can start to lose range of motion, especially knee extension, because we start guarding that area that hurts. It can cause our thigh muscle, our quad to start shutting down. And then that just further puts stress on our knee joint and causes more pain. When if we restore that knee extension, if we improve that quad firing, it can help improve pain a lot, help pain with walking and going up and down stairs, standing up from a chair. Let's say, okay, you've had this checked out, you know you have arthritis, maybe you'll need a knee replacement one day, maybe not. Maybe it's something that surgery is not going to help. Let's dive into how we deal with this pain more and continue to move. Motion's lotion. So if you've ever been, again, to PT, you've probably heard this because it's our favorite saying. Arthritis likes movement, our joints like movement. And so the more we can perform gentle movement, not extreme ranges, the happier our joints are. So let's start with aerobic exercise. This is one that we tend to do more just because walking's easy, it's cheap. When it's not wet and freezing outside, we can do it outside pretty easily. So let's start with aerobic exercise. So we're having pain. biggest, most important thing that most people miss is warm up. So prior to starting any activity, if you're going to go on a walk that's a longer duration, start performing gentle range of motion for the whole body, not just the legs, not just the back. You want to make sure you're getting the whole body involved. And that just helps fly the muscles, warm them up so they work better. So I just pulled this off the internet, pretty easy. Maybe not going into deep ranges of motion like the lunge down at the bottom, but just some gentle, easy movement. I like circular movement. So maybe, you know, shrugging our shoulders in a circle, moving our hips in a circle are really good to kind of help open our joints up and just kind of get them ready for some more activity. If one joint is really stiff, you can always use a hot pack for 5-10 minutes. Make sure it's not too hot where you burn your skin, but just a hot pack on a painful area can help kind of warm it up for exercise. And then if you're starting an exercise routine for the first time, maybe with joint pain, start moving gently. Don't go straight into a heavy leg or a 2-mile walk. Start with easy movements, maybe a slower pace than you think you need before you start any faster, higher impact activities. Same if you're already doing some activity. So if you're already walking, if you're having some soreness, start a little slower pace before building up to the pace your goal is, whatever you're trying to get to. And we don't have to jump in feet first into a cold pool. We can kind of dip our toe in, wade in there, and get going a little easier without so much pain on our body. Oh, backwards. So the other way we can help deal with joint pain with aerobic exercise is reducing impact. So finding activities that reduce stress on a joint. Walking versus running is a big one. So I think we all grew up saying that running was bad for our knees. There was one study in like 1972, I'm pretty sure, that said this. It's not necessarily true. If you were a runner growing up, you don't have arthritis just because you ran. There's a lot of stuff involved in it, like we talked about. But running is a lot more impact now than walking. So if you're dealing with pain, maybe walk instead of run. If running is something you really want to do, go see someone and see if it's feasible. We can get a lot of people back to a lot of things. A lot of people run with arthritis or after a joint replacement. Not always recommended, but it is possible to get back to stuff you want to do. It just might take a little more specialized work, but if we're just talking, trying to get some activity, running is less impact than walking. Same with biking. It's a lot less impact on our hips and on our knees. We can do it inside on a stationary bike. We can do it outside too. The only things with biking is we do need enough range of motion, especially in our knee and our hip. So it takes about 110 degrees of knee flexion to comfortably, continuously cycle. And it can be irritating on the spine. So if you see that top picture there, excuse me, you see that top picture there, that person is kind of flexed forward, which isn't a bad thing, but if our muscles in our back aren't strong enough, that can be irritating on the spine. I know I don't cycle a ton, and when I do, my back can get a little sore just from being in that position a lot. So that's something that you might be aware of. If it's something you have back problems, being in that position isn't comfortable, there's options like a recumbent bike like below. That's an outdoor one. There's indoor recumbent bikes at most gyms where it has a seat back. That also requires a little less range of motion. So just finding different options, adapting a little bit to make things more comfortable. So what about resistance training? So same principle here to start with, warm up and start slow. So again, big joint movements, easy range of motion. A lot of people don't have as much experience with resistance training just because it's thought of as a powerlifting sport, which isn't always what it is, not true. But if you're starting a resistance training program for the first time, start slow, limit your range of motion to tolerance. This also goes for if you're trying to get back to resistance training. So say you're doing a sit to stand. If standing from a normal height chair is painful, put a couple pillows in the chair and bring the height of the chair up to where it's a little more comfortable. Same with a squat. Limit your depth of squat. You don't have to go to 90 degrees. Start lighter than you think you need. Body weight exercises for higher repetitions are a great way to begin. That's how I start most of my patients when we're starting a resistance training, is just a little lighter than might make them sore. Double limb exercises for lower leg stuff will be less intense. So a double leg press or sit to stand versus a step up, it's not going to be as much force going through a lower extremity joint or your back. On the other hand, an upper extremity, so a bicep curl per se, if you're having back pain, you might do a single arm because it's when our hand is in front of us, this is where it's hard to show on Zoom. If our hand with a weight is in front of us, so you're getting a plate even or a gallon of milk out of the fridge, our back has to fire, our muscles in our back have to fire to keep you from tipping forward. So same with when we're lifting weights for exercise. If we're lifting 2 weights at the same time, our back has to fire twice as much to keep us from tipping forward. So on upper body stuff, maybe just do 1 arm at a time. Lower body stuff, do 2 arms at a time. The other important thing that we miss, because we think, you know, if less is more is more, right? We have to allow for rest. You have to allow for joints to recover. You have to allow for muscles to recover in order to not aggravate joints, tendons, everything that we need to stay healthy. You want to avoid working the same muscle group if you're lifting heavy for back-to-back days. Now, if you've done PT and you've done exercises every day, that's totally normal. Early on, we like to just kind of apply. They're usually not as heavy of exercises. But as far as an actual resistance training program, you want to avoid back-to-back days to allow for recovery. Typically 48 to 72 hours should be enough time between sessions working the same group. So if you're doing full body 2 times a week, maybe Monday and Thursday or Tuesday and Friday. If you're doing upper body 1 day, lower body 1 day for 4 days a week, maybe do upper body Monday, Thursday, Tuesday, Friday, lower body, just to give that time to recover. The other important thing is to focus on form, not just of the form of the stuff you are trying to work, but also form of your posture, everything else in alignment. So if we talk about our squat, this is the same for any squat, step up, sit, standing up from a chair. If you look at that top picture, that one on the right that says bad, you can see those knees are kind of caved in towards each other versus the one on the left, those knees are nice and aligned with the feet. Now, squat form is going to depend on your range of motion, your strength. Sometimes people like to turn their toes out. That is totally fine. You just want to keep those knees wherever the feet are pointing. With that bottom one, I really pulled this because what I notice a lot, and we deal with neck pain a lot, right? You know, our heads are heavy. We end up dealing with neck pain as we get older. So a lot of times when we start exercising and we start doing something, our head will naturally drop. We don't really focus on keeping our head up. And on the left there, you can see that neck is in good alignment. The back is nice and flat. That's going to stress those joints in your neck and your spine a lot less when you're trying to work, you know, our shoulder in this case, versus that one on the left, our shoulders kind of shrugged up, our necks drop down. That's going to create stress in other areas, even though we're not necessarily trying to work the neck in this situation. But it's something to keep in mind, keeping your alignment good with all your exercises you're doing for resistance if you're having joint pain anywhere. All right, so this is one I just wanted to pull because like we kind of mentioned earlier, you know, it's almost counterintuitive to load a joint that hurts. So this study that came out a few years ago just looked at resistance training dosing on pain with people with knee arthritis, which is very, very common. Systematic review is just that it reviewed multiple studies. It did not actually do a study itself, but these were all high quality. There was 11 studies. And the most common routine that these studies implemented that found good results were about 30 to 60 minutes sessions a week, 3 times a week. This went 24 weeks. You know, if we're extending this lifelong, that gets a little more detailed, you're going to do that for longer than 24 weeks, obviously. But sessions consisted with exercises in 2 to 3 sets. 8 to 12 reps is a great range. That's what I work in a lot. And that's starting to about 50 to 60% of our 1 rep max, which we'll talk about how to work around one rep max a little bit, because I don't expect any of you guys to go max out anything. I don't max out anything anymore. I'm not in high school and have no need to do that. But a large effect size, so that just means really good results on both pain and physical function, were found for 24 sessions and 8 to 12 week duration. So when you are working on stuff and you're trying to get a pain better, it's not going to happen overnight. You have to give it, I mean, 3 to 6 months really to truly make improvement long term. Okay, so are we doing enough? So this is kind of how we're trying to get around that 1 rep max. And again, I know not everyone has resistance training experience, and that's okay. But we use a lot, and I use this a lot in my practice, is this kind of reps in reserve, and RPE is just rate of perceived exertion. So what happens a lot when we're doing resistance is we're just not quite loading enough. We're not lifting heavy enough to truly see changes. But if we're starting a program, I want you to start in that very light effort if you're starting resistance training. So this would be, for example, if you're doing a leg press at Rock Chalk Park, because I know they have one, say you try 100 pounds. You're able to do that 12 of that rep range, but you feel like you could probably do 10 more. That would be that really light effort. And that's where I want you to start. That's a great way to gauge, how does this make my knee feel? Do I need to change anything? Am I going too deep? That's a great place to start. See if it makes you sore. Your goal would be, ultimate goal of working resistance training with pain or without pain is about 3 reps left in reserve. So say you do that 12 and you're like, whew, that last one was pretty tough. I could probably do maybe 2 or 3 more. That's kind of where you want to work. That's a pretty good sign that you're doing enough without having to go and do as many as you can, because that's probably going to aggravate whatever joint is hurting. Same, so we can use RPE with our cardio. We said 150 minutes of moderate or 75 minutes of vigorous activity. The reps obviously don't make sense, but if we look at an RPE scale, this 10, 9.5, 9, 8.5 even, that's going to be your vigorous activity. This is, you cannot talk when you're exercising. It is your high intensity sprinting. Probably not as many of us are going to be in that vigorous activity range, just because it's a lot more stress overall on our body and a lot more stress on our joints. Our goal would be into that moderate range would be, you can feel your heart rate elevated. You should be able to carry on a conversation, but you might have to stop and take a couple breaths. That's a good moderate range. Very light is we're sitting here just having a conversation. We're kind of in this very light effort, not really doing much, no heart rate elevation. So that's not really as much cardio as we need. Push the speed a little more, maybe add some hills if we need to, as long as it feels okay. But our goal is to get into that, we want our heart rate elevated range. So for resistance training, do we need equipment? Equipment's expensive, or we have to join a gym maybe that can get expensive. Maybe we're on a fixed income. You don't need equipment. I've given full exercise programs. I've done full exercise programs without weights. You just use gravity to work against you. We can do sit to stands. We can modify sit to stands to make them harder if that's too easy, by staggering a foot maybe, or going lower. We can do step ups if you have stairs, or you can get a little step stool. That's all you need. Wall sits are a great quad exercise, and it's pretty easy on the joint. You don't have to go this deep. We can make it harder. We can make it easier. Lunges, we can not go that deep. I don't recommend most people do. We can use support. Bridges are a nice simple one. You can do those on a bed if we can't get onto the floor. We have hip abduction, which is going to work the side of the hip, which is a great exercise if maybe you're dealing with some outside hip pain. We can also lay on our back and lift the leg straight in the air. That'll work the front of the hip. And then for upper body, we can do push-ups. If we can't do them on the floor, we can do them on a countertop or on a wall. Same thing with a plank. We can do a plank on the ground, or we can do it on a countertop. We can also do it on our knees. So there's a lot of ways to modify exercises, just working with gravity and our own body weight, that gives you a great workout and gives you those benefits of resistance training. Okay, so what if we've tried modifying? We've tried resistance training within a limited range, lighter weight. We've tried walking and it just still hurts. Maybe we have a little more severe problem that we don't know what to do about. Do we have another option to keep moving? Absolutely. This is kind of my bread and butter. Aquatic exercise. We get a ton of people in our pool that have joint pain. I know there's a ton of people that go to the aquatic center that have joint pain. You guys might be some of them. Exercise performed in aquatic setting is an excellent alternative to land-based aerobic and resistance exercise when you're dealing with joint pain. Maybe you have lumbar stenosis, which is really common, that just standing upright is painful. So you can perform aerobic and resistance exercises in the water. And there's a ton of stuff you can do other than swimming laps. You can do stuff where you're weight bearing if you're not comfortable treading water. You can use equipment to increase resistance or to help with balance and reduce body weight. You can use it for either way. It's also a safe environment, so you reduce risk of injury from falls into water. Don't fall walking into the water. But we have a safe environment where, you know, maybe if you do lose your balance a little bit, then the water is going to help if you fall, soften your fall. I have yet to have anyone actually fall while in the water and go underwater. But if you do, the worst that happens is your hair gets wet. So how is water beneficial to joint pain? Our first property we talk about a lot is buoyancy, and that's just our ability to float in water. Our body, we tend to be less dense than water unless you're really, really muscular, then you might sink. So this helps reduce our body weight and then thus the forces that exert on our joints when performing any activity. That chart on the right there is just how much body weight is offloaded. So if you're up to your neck in water, you're only about 10% weight bearing. And then as you are in more shallow water, that will increase your weight bearing. So we can put you really deep underwater and have almost no weight on your back. The other benefit is the resistance we get from the water. So water is obviously much thicker than air. So it will provide resistance when doing exercises without having to create that really heavy external load with a weight or with a band or with gravity. And we get it in multiple directions. So if you kick out to the side, standing, you get a little bit of work from gravity if you're on land. If you're in the water, you get resistance both kicking out and pulling that leg in. So you're getting that joint worked in multiple directions versus on land. The other thing that is really beneficial and people really like for their joints is that hydrostatic pressure. So the pressure the water actually exerts can help make that joint feel a little more stable and supported. The last part is temperature. So warm water especially is very soothing to joints, muscle pain, aches and pains. This can be a great way of people that really can't exercise on land, but they do great in the water. They go to the aquatic center and, you know, stay pretty mobile and help manage their pain without having to do a lot on land. So there's a lot of, like we said, there's a lot of types of aquatic exercise. There's aerobic, you can swim laps, tread water with or without assistance. Treading water without assistance is tough. You can water walk, water jog. There's HIIT classes, which are more in high intensity interval training. So that would get you into that more vigorous exercise routine without as much stress on your joints. You can do resistance exercises. There's also balance classes. Tai Chi is Tai Chi in the water. Okay, so then this goes for all exercises. So soreness rules are what we talk about as you're either getting into an exercise routine or maybe dealing with some pain while you're exercising. Even if you're, you know, a regular exerciser and you still have joint pain, this can be something you can help manage some of that joint pain. So if we're talking about joint soreness or muscle soreness, if during your warm-up that soreness goes away, you're going to keep your intensity at whatever level you're at. So we got to start this program before we can use these soreness rules. If soreness stays the same or worsens during your warm-up, you're not going to do your exercise for that day. Maybe you go walk or hop on the bike if you're planning on resistance training, or get in the water, something a little more less intense if you're still wanting to move. Take a day or two off and then back your intensity off a little bit. So maybe you tried to go up in weight and it just was a little too much, back that intensity off. If soreness goes away during the warm-up and then comes back during it, take a day off, don't make anything harder, give yourself a little rest. So then soreness the day after the workout, I find this is what some people just, you know, maybe don't quite understand as much. Muscle soreness is totally normal the day after you exercise, especially if you're starting a new routine or increasing. If you're getting this muscle soreness the day after, you want to stay at the same level, or if it's light soreness, you can increase a little bit. Joint soreness, you're going to take a day or two off and then maintain the same level intensity. So this kind of goes back to those rest principles. We want to make sure we're giving plenty of rest to allow things to recover. So muscle soreness, this is what we're talking about. We call it delayed onset muscle soreness. This is a pretty normal principle. This is that soreness you get 12, 24 hours after you either exercise or do an activity. I know every spring when I start doing the garden and all the flower beds, my hamstrings after the first day are sore for about 3 days and I cannot walk. Totally normal. It usually is the worst about 24 to 72 hours after activity. And it's just our body's reaction to placing a load or demand that we're not used to. So I don't garden obviously all winter, but once I get back into it, it isn't quite as bad. Same with resistance training. If you're increasing weight, you might feel that muscle soreness. If you're trying something new, you might feel it. I think pretty much every pool patient that might not be super active on land because it's painful, they feel so good in the water. They always do a little too much that first day and are sore for a few days after. So I like to warn everyone about that. Even in the pool, you can get this delayed onset muscle soreness. Another way to kind of look at this is I like to use stoplight comparison. So green, yellow, or red. So green is our good to go. You're good to push yourself maybe a little bit, increase intensity, definitely work out. This would be a diffuse soreness that stops or only lasts a few hours. So say baseline, we're going to say knee pain is a 2 out of 10. It's pretty diffuse. It's not really point tender. If it stops once you start exercising or only lasts a few hours after and it doesn't significantly increase, you're okay. Stiffness that should resolve with some movement, snaps, crackles, pops. We all snap, crackle, and pop. Am I right? Painless. As long as they're painless, that's pretty normal. We pop a lot. It's usually just air bubbles and not usually anything to be too concerned about. Maybe when to take a little more note and maybe hold off on the intensity and just do some gentle movement is if you're having pain that's present at rest, so maybe a little more focal pain, but it improves with activity and is worse after. So again, if you're at that 2 out of 10 at baseline, gets better when you exercise. And then after, if it's more of like a 4 to 5 out of 10, that might be doing a little too much. It's not anything that you need to be really concerned about, but just don't push it much more than you are. If it's lasting more than a few hours, if it's going 8, 9, 10 hours after activity, and this is right after activity, 2, 8, and 10, it's not that delayed onset muscle soreness we just talked about that starts 12 hours after activity. Or painful pops. If you're getting painful pops, limit your ranges, try to avoid those painful pops as much as you can. And when to stop and maybe get checked out. So if pain worsens with activity or lasts more than a few hours, so if you're starting at a 2 out of 10 and with warm up and throughout your exercise, if that pain's getting up to a 5 or 6, it's too much, back off, take a break. If you're getting any sharp, severe pains with movement, or if you're feeling any instability or joint giving out, that's another thing to really take note of. Maybe go get checked out. There might be some stuff we can do, but you don't want any feelings of that joint giving out. That's a risk of a fall. So just other tips. This is some stuff I commonly get asked, so I wanted to cover it now. So what about bracing? I'm not the biggest proponent of bracing, but there are situations where it can be beneficial. It's not a great picture. There's one in the background. We call it a medial unloader brace. We use it a lot if you have arthritis in the knee on just that inner compartment of the knee, so the inside. It can help just kind of open up that space. Those are great if you're trying to put off a knee replacement. Wrist brace, say you're dealing with more finger, hand arthritis, wrist pain, and you want to work out other areas of your body. Wrist braces, wraps, gloves can help if you're trying to grip weights. I've had people with really severe arthritis. I'll use wrist weights or ankle weights on their wrists to allow them to do some shoulder work without having to grip the weights and irritate their hands. Compression sleeves I do really like, especially if you're dealing with some arthritis. It can help with just some feelings of stability. It can help with some joint swelling that we get commonly with arthritis without being overly supportive, and it'll allow you to still help with that muscle strengthening that we really need. As far as wearing a hinged knee brace all the time, unless it's something where you know you have a problem that can't be addressed as much with surgery or physical therapy and you have instability, then yes, absolutely. If physician's recommending a brace, go for it. Are there any medications you can take to help with joint pain? Probably, but that is not my scope of practice. So talk to your primary care or orthopedic provider, because I don't give medication advice. Other tips, this is one I see a lot: hydrate. Up to 28% of older adults are dehydrated chronically, and our body's 2/3 water. We've heard this a lot, but we really need to make sure we're hydrated. I'm not going to give specific numbers just because there are always dietary restrictions. So I don't want anyone to go say they need to drink 100 ounces of water when they're not supposed to be doing that. But between your food and your water intake, you should be getting a good amount of water. It should be more than 2 just normal water bottles, which is what I hear a lot. And when in doubt, seek help. Physical therapy, there's a lot of chronic pain or a lot of joint pain we don't have to live with. And physical therapy or a trusted healthcare provider can really help with that. So they can help you more specifically determine what might be causing that pain, what your aggravating factors might be, and then how to help that. Even if it's a pain that maybe you're going to deal with on and off for the rest of your life, they can definitely help manage those symptoms. Physical therapy is a little more short term. We can't see you forever, but group classes and personal trainers are another great way to provide support to help keep you moving, get you moving. It might help with your feelings of safety. There's personal trainers and group fitness instructors that are great that can help you modify as you need to help avoid joint pain or aggravating any injury. And most importantly, find something you enjoy doing. You're more likely to stick to it, and some activity is better than nothing. So if you enjoy pickleball, that's a great cardio. If you enjoy golfing, that can be great cardio. If you just like walking, that's awesome too. Just something you enjoy that you'll stick to is great. And also, never do anything you don't feel safe doing. I don't want you to go into a gym and try to lift weights if you don't feel safe. Talk to someone. Either I've had people come into PT just to get an exercise routine and learn some machines. That's personal trainers are great for that too. You don't have to see a personal trainer forever, but they can help you learn equipment that's in the gym you're going to. Just keep track of time. We're almost done. And then there's some community fitness options. I know we all talk about gyms are expensive, but Lawrence has some great group fitness community. If you're a Douglas County resident, then Rock Chalk Park is available to you. They have group classes. They have a great indoor track for this time of year where it's crummy weather. They have a little weight room that if you can get there in off hours isn't too bad. We have classes, so there's aerobic dance classes, there's Pilates, there's strength training specifically for seniors, there's 5,000 TRX, core strengthening, Tai Chi is great for your balance. And then there's some aquatic. I know a lot of people do jive and joints, aquafit, shallow shakers. There's some deep water ones too. That's just colder, so I avoided those. Most people don't like the cold water this time of year. But this is all online on Douglas County's website. There's a Parkinson's class that one of our PTs teaches that she is awesome. That's all I have. So thank you. Here's my info and I can send this out. If you have any questions for me that don't get answered here, I'm going to go through the chat here. Feel free to reach out on email. We have a lot of locations for LMH for therapy, and I've worked with, I think, almost every PT that we have. I've worked in Eudora, Tonganoxie. I've worked with the group at 6th and Main. I was at the hospital for a little while because South had a water main break. I'm out West Campus right now. Like I said, I'm in the pool. So yeah, we have great options if, maybe West is a little too far out or, people.
Before we
Okay,
go,
so-
just
Yeah.
before we go forward with the questions while you're unsharing here, if I will send you an email. So if you'll send me the slides, if you don't mind doing that.
Yep.
I just want everybody to know that what I'll do is I'll send that out. When I send the link to the recording, for this, which will be on our YouTube. So you'll have both the recording and the slides if you need to go back and look at more specific things or kind of review anything. So I just want that said before we go forward. And then if you can go through the questions or I can read them, whatever you want. I think we started with, I'm sorry, what was the question about, is there a warm water place to do water aerobics that you know of in Lawrence?
Yeah, I have them pulled up too. I can go through them.
Okay.
So the aerobic exercise, warm water, I know the Lawrence Indoor Aquatic Center has increased the temperature, and you haven't been over there in a while, in the shallow pool. The lap lanes are freezing. So yes, I don't blame anyone, but the shallow pool is about 86 degrees. That's only 4 degrees colder than what we keep ours at, which is 90. That's pretty warm. I'm not sure why did I just blank on the name of the gym in town that has a pool? They also do Silver Sneakers. I'm not sure what they keep theirs at. Theirs is fairly warm. It's in the 80s. You can also do things like buy a neoprene jacket will help keep you really warm, like divers wear. They don't have, you can do the full suit, but they have jackets that I've worn when I did a lot of aquatic therapy, not here where our pool is really warm, and that can help a lot if it's something with being cold. So what about pain or stiffness or soreness after being sedentary or sleeping? This is a very, very common thing. So we went back to the motion is lotion. It's same thing if you're sleeping or just sitting for a long period of time, especially if you have arthritis, which is usually what it is. It can also happen with a tendon problem or any other kind of joint problem, but very, very common if you've been sitting. I always recommend try to move around. So depending on where it's at, if you're in bed after you're sleeping, I like if it's your back, lower trunk rotations, just kind of knees bent side to side. Just get moving a little bit before you get up is a great way to help with a little bit of that. Calf muscle pain when walking. So I'm not going to give a ton of specific advice just because it's hard to do without really getting eyes on you and seeing. If you have calf muscle pain with walking, there's two. It could be an actual muscle problem, just calf weakness, or maybe there's something with your gait. I would recommend, if you haven't been seen by a PT, go ahead and get checked out. We have some great walking, running therapists that are great with calf foot injuries. The other thing, if you have known stenosis or anything in your back, there's something called neurogenic claudication, which can cause some kind of calf cramping. But that, again, that's something that either a doctor or a physical therapist should be able to differentiate which one that is. How much balance training is recommended? Also, best exercises for core without getting on floor and risking joints. The CDC does not give a specific balance training recommendation. Part of that is that you get it a lot if you're walking or doing other stuff. I tend to recommend at least a little bit every day. It doesn't have to be a ton, but 5 minutes. You can do it if you're standing at the sink washing dishes, brushing your teeth. Try to stand with your feet in different positions. You can try to walk one foot in front of the other, great ones. There's a lot of core exercises you can do on your bed that aren't risky on your joints. It's going to all depend on kind of where your core level is but you can do just a TA, kind of deep belly squeeze, trying to push your back into the bed. There's a lot of standing stuff you can do. It's hard to explain on Zoom. But again, a PT would be able to help you with some of that and give you a good set of exercise. And it wouldn't take 10 visits. It would take maybe 2 just to make sure you're doing them right. So sorry, I can't give a lot of specifics on this one. So what about chronic one-sided inner knee pain that just stays around regardless of? So 1 to 2 range, that's pretty livable pain. I always say, if it's not affecting your day-to-day activities, probably something you can deal with. You can absolutely get checked out and see if we can make that 1 to 2 range better. But 1 to 2 is pretty, for most people, 1 to 2 you should be able to deal with, just kind of live with it. Like I said, that medial and loader brace, especially with that 1 to 2 range, I wouldn't go that clunky of a brace because they're kind of a pain to get on and off, especially if you're going to be wearing pants or anything. But if it's starting to affect your daily activities, absolutely go get pain checked out. For insurance to pay, it depends. If Medicare, we tend to just say, go ahead and get a referral from your primary care or orthopedic. A lot of times, if you know them well, you don't even need to see them. Just call them and say you want to go to PT for whatever hurts, and they'll send it over. If you're commercial insurance, still direct referrals work great. If you're TRICARE or VA, they have to do prior authorization, which you guys probably know already because it's prior authorization for most stuff with the VA. But Medicare, we like to have, just for safety reasons for insurance, we like to have a referral placed. Yes, so someone answered seniors, warm water pool, 10:45 to 12:45, Monday to Friday. And Ellen, correct me if I'm wrong, it used to be over 65 on Wednesdays, I think was free. Why does cold, wet, damp weather like today cause joints to ache more? Research-wise, we can't fully say. A lot of times they say it's pressure systems that affect it, but we don't really know why the cold weather causes joints to ache more, but it does. It does for me too. Genesis, thank you, Kathy. That's what I was thinking. Yeah, Genesis on 6th Street has a pool. I believe it's fairly warm. I've had patients go there. They also do senior sneakers or silver sneakers there, last I knew, which is a great group class that insurances sometimes pay for. So that's another option if you're interested. I think I got all the questions unless anyone has any more.
Is there any more? I don't want to take any more of just time than we promised her, but if we can type in any more questions, let me know. We'll just wait a second to see if any pops up. Yeah. I don't see any coming. So obviously a big thank you for our presenter. I think that was excellent. Really helped a lot of with a lot of answers and a lot of information today. Really appreciate that.
Yeah, I'm glad to be here.
Yep. And I will remind everybody, we do have, for those few people who are interested, we have a D&D session tomorrow through Retroactive. And then we have tour through ichthyology on Thursday and fun and games on Friday. And it sounds like I need to make everybody get up in the middle of fun and games from their table and do some exercising. So we'll see how that works. But once again, thanks very much. Allison will talk about what LMH is doing in her next presentation. She had some technical issues and kind of lost contact. So thanks everybody for joining us, and we'll
Thanks,
see you at
guys.
the next event. Jess, I'll email you my email for the presentation.
Perfect. Thank you.
Thanks. All right. Have a good evening, everyone.